Another big story this morning, of course, the COVID crisis. It hung over every aspect of Inauguration Day, and yesterday marked the country's deadliest day yet in the pandemic. More than 4,100 lives lost just in the last 24 hours. President Biden says combating the virus is his top priority. And after taking some initial steps after being sworn in, he plans to announce a comprehensive strategy today. Dr. Anthony Fauci joining a press briefing at the White House later. And joining us now is one of the experts who will lead that charge, Dr. Rochelle Walensky, the new director of the CDC. Dr. Walensky, good morning. Thank you for your time, ma'am, on a busy first day.
Good morning, Savannah. Thanks for having me.
Well, we have a lot to get to it, and let's just start with this huge promise that has been made by President Biden: 100 million doses, shots in the arm of the vaccine in 100 days. How are you going to do it? How are you going to get up to 1 million doses starting right now today?
Right. It's been the work that we've been doing for the last weeks to months. What I will say is, we've had several landmarks this week. Yesterday was a year since our first case in the United States, and Tuesday was 400,000 deaths that we hit in this country, with an anticipated 100,000 more at our current pace by the middle to end of February. So we recognize this is the most immediate emergency to get this country back to health. There are numerous plans as we think forward as to how we're going to get people vaccinated. We need to make sure that we titrate the amount of vaccine that we have for the amount of people who are eligible, so we don't have vaccine on the shelves and yet we don't see the footage of these long lines. So we really need to match that and expand our eligibility to make sure that it fits with the vaccine supply. We need to make sure that there are enough vaccinators out there, that we have commissioned health corps, that we have medical military, that we have retirees, medical students and nursing students who are just about to graduate, dentists and veterinarians, in order to be out there to vaccinate the public.
And can you start that work today? I mean, that's the thing. You know, a huge promise was made, and people have heard promises before. So, I mean, can that work begin today?
That work, the work in the planning we've been meeting daily at least for 6 weeks or so. So that work has begun already, and we are on the ground. The plan was not to start planning today. The plan was to start working today and to get it out to the people.
Let's talk about.
We need to make sure that we have it
Yeah, I'm sorry to interrupt, but let's talk about supply, because, New York, for example, said, they've had to reschedule appointments because they ran out of vaccine. Is there a supply issue?
We are working closely with General Perna, with the manufacturers, with the states to understand exactly where the supply is. And as you noted earlier, the president has a plan to signed in to use the Defense Production Act to see exactly what it is that are the resources that we need, either in the vaccine production or in the vaccine distribution or in the vaccine administration. Do we need syringes or do we need chemical products?
And do we know the answer to those questions?
We are working towards the answer to those questions. We're day 2 in the driver's seat, but we understand exactly. Right now, I think we still have vaccine on the shelves that we need to get into people. So we're deploying, places that we can get them into people. We are looking at community vaccination centers and stadiums and gymnasiums. We're looking at mobile units to really get to every corner of this country, federally qualified healthcare centers, and pharmacies. So we're looking at a rollout plan that will be diverse so that we can get to all people.
It's such a strange situation because on the one hand, you have millions of Americans who are just chomping at the bit. They want to get that vaccine. And then you have some frontline workers, some have reported up to 40% of their health workers aren't getting the vaccine, don't want it, want to wait and see. How do you explain that, and what message does that send?
Right. I think we have a lot of work to do in both of those spaces. We have to make sure that, as I noted earlier, that we titrate the number of people who are eligible to the vaccine supply. And then we have a lot of work. The whole basis for how we do vaccine rollout has to be based on equity, and we're committed to that. And as we do that, it may be a little bit slower on the uptake for people who are vaccine hesitant. The vaccine hesitancy comes in numerous different flavors, I will say. Some people really really just need it to be convenient. Some people need to have permission to take the time to get the vaccine or enough leeway to be able to take the day off if they're feeling unwell the next day. Some of it is they just kind of want to see how it's going to go. Some of it is education. And what is it that what is it that they're hesitant about? What is the science that they need to understand? And we need to bring that science to them by their trusted people, by people who they trust. So we're working on all aspects of that plan.
And then real quickly, because I'm just about out of time, but I had the HHS secretary under the past administration, Alex Azar, on in December, and I said, when are we going to get to that day where it's like the flu shot? You could go into your grocery store, pharmacy, or the CVS or whatever, and there's going to be widespread vaccine available for the rest of us, the general population who don't meet that priority group. And he told me it could happen as early as late February, early March. Do you agree with that timeline, or what timeline do you think that day might come?
As we talk with the manufacturers and we think about the supply and eligibility, we are going to, as part of our plan, put the vaccine in pharmacies. Will it be in every pharmacy in this country by that timeline? I don't think so. And as I said early on, I'm going to tell you the truth here. I don't think late February we're going to have vaccine in every pharmacy in this country. We said 100 million doses and 100 million in the first 100 days, and we're going to stick to that plan. But I also want to be very cognizant of the fact that after 100 days, there are still a lot of Americans who need vaccine. And so we have our pedal to the metal to make sure that we can get as much vaccine out there. As has been noted before, we are hoping to have more data from another manufacturer, from the J&J vaccine. The more vaccines we have out there that have FDA authorization, the better shape we'll be.
Yeah, and the J&J is the one shot, so that will help as well. Dr. Walensky, thank you for your time on a busy day. We hope we'll be talking to you over the months to come on this important topic. Appreciate it.
Will do.
By the way, Dr. Walensky used a term I had not heard of. I had to look it up. Titrate apparently means continuously measure and adjust the balance of a drug.
It's funny because I did look over at Hoda and I said, tritate? Yes. Okay, good. So we're all in this together.
Yes.
Doctors, happened. They're not like us.
No, they're not. Thank you.
Right.
Thank you.
Oh, look, she's laughing. Did we get that right, Doc?
You did.
Okay, good.
Sorry.
All right, good.
For Google.
Yeah, we don't have an MD, but we can Google. Yeah, thank you, doctor. Appreciate it.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.